Hello, my name is Gladson, a Bachelor of Nursing student at the University of Canberra. Throughout my clinical placements in acute medical, renal, and aged care settings, I have developed strong nursing foundations in person centered care, safe practice, and effective communication. My experiences, combined with my background in disability and mental health support, have prepared me to thrive as a graduate registered nurse with Canberra Health Services. 1. During my placement in Ward 8B, renal unit, I supported a patient undergoing dialysis who had limited English proficiency and was experiencing anxiety. I used clear, simple language, non-verbal cues, and actively listened to his concerns, checking understanding frequently. I involved the interpreter service and communicated with his family and the nursing team to ensure shared understanding of his care plan. By building trust through respectful and patient communication, I was able to reduce his anxiety and encourage adherence to his treatment. This experience has highlighted how vital interpersonal communication is to safe and effective care. 2. If I were to make a medication error, my first priority would be the patient's safety. I would immediately stop the administration if possible, assess the patient, notify my RN or supervisor, and document and report the incident honestly, according to the policy. During my placement on Ward 8B, I administered medications under the direct supervision and always followed the SITS rights of medication administration, checked allergies, and double-checked S4 and S8 medication. I also clarified any unclear orders. This vigilance combined with timely communication helps prevent harm and supports culture of accountability and safety. 3. During my placement on Ward 5W, I had a shift where I was supporting multiple patients with high acuity needs, one requiring frequent BGLs, another with cognitive impairment, and one waiting for transfer. I felt overwhelmed but used prioritization frameworks like the A to T and ISBA assessments to organize care. I communicated early with my buddy nurse to delegate tasks safely, use clinical handover tools to stay focused, and refer to the visual floorboards for patient needs. By staying calm, asking for support, and reflecting afterwards, I was able to maintain patient safety and manage the shift effectively. 4. Across all my placements, I have followed the NSQHS standards to ensure safe and quality care. At Goodwin Aged Care, I adhere to Standard 3, preventing and controlling infections by following strict hand hygiene, wearing appropriate PPE, and safely disposing of sharps and waste. I participated in clinical handovers using ISBA, supporting Standard 6, communicating for safety. For WHS, I used safe manual handling techniques when assisting residents with mobility aids and promptly reported environmental risk. These actions reflect my commitment to working safely while supporting a culture of continuous quality improvement. 5. In the renal unit, I care for patients experiencing emotional distress during their first week of inpatient dialysis. I demonstrated compassion by sitting with them during observations, providing reassurance, and including them in planning their daily care activities. I acted with integrity and accountability by communicating concerns about their mental health to the RN and social worker, facilitating timely psychosocial support. By collaborating with allied health and maintaining consistent empathetic care, the patient became more engaged and expressed more gratitude and respect for the holistic support. This experience reflected the CHS values in action and reinforced the power of person-centered care. Thank you for the opportunity to share my experiences. I am committed to providing safe, compassionate, and evidence-based care, and I look forward to contributing to Canberra Health Services as a graduate registered nurse. Thank you.